Good evening and welcome to the 7 o'clock English news from the Sultanate of Oman Television. First headlines. His Majesty Sultan Haitham bin Tariq presides over the meeting of the Council of Ministers and directs to accelerate procedures for analysing and needs to apply technology and vocational learning. His Majesty clarifies that the coming phase needs coordination of all efforts by the state institutions to provide services, overcome obstacles, and hails the efforts exerted to deal with COVID-19 pandemic. And His Majesty stresses on the continuation of economic cooperation with Gulf Cooperation Council countries and the Sultan's firm stance towards achieving peace and stability for all. Those were the headlines, and now the news in detail. His Majesty Sultan Haitham bin Tariq presided over the meeting of the Council of Ministers held this morning at his headquarters in Muscat. His Majesty began by thanking Almighty Allah for the blessings in the beloved country and loyal citizens, praying to Allah to lift the pandemic from the world. His Majesty reviewed the current local and regional situation, where he affirmed on the employment of job seekers, which is considered as national priority for the government, indicating the importance of translating the efforts exerted by the state sectors into reality to provide opportunity for the youth to contribute in the march of building and development. His Majesty directed to accelerate taking procedures necessary for analysing the needs to apply technology and vocational training to be in line with the demands of labour market, as well as setting up an integrated plan, define expertise and human resources necessary in this regard. His Majesty clarified that the coming phase needs coordination and harmony of all efforts exerted by the state institutions to provide services and overcome obstacles that may hinder the comprehensive development march, and providing new and efficient methods for all sectors to uplift and accelerate the work. His Majesty the Sultan hailed the efforts exerted by dealing with the COVID-19 pandemic and forward his thanks to those working in health sector, emphasizing the continuation of efforts in vaccination campaign, as well as the necessity to aware the citizens and residents of committing with all procedures issued by authorities concerned in this regard. Within the context of viewing the regional issues on continuation of economic cooperation programs with Gulf Cooperation Council countries, His Majesty stressed the Sultan's firm stance towards achieving peace and stability for all. His Majesty concluded the meeting by wishing all the best, good omen and progress for this beloved country and its dear citizens. His Excellency Sayyid Badr bin Hamad al-Busaidi, Foreign Minister, received His Excellency Ali Asghar Khaji, the Senior Advisor to Iranian Foreign Minister for Special Political Affairs. During the meeting, the two sides stressed on the friendly relations between the two countries and the common determination to continue bilateral cooperation and partnership in various fields. On the political level, the two sides exchanged views and opinions on a number of current regional and international issues of common interest. The Ministry of Health reports 3 confirmed cases of mucormycosis in COVID-19 patients, 33 COVID-19 fatalities, 2,126 new cases, and 570 recoveries. The total number of COVID-19 cases in the Sultanates reached 238,566. The total number of deaths reached 2,565. The total recovered cases reached 211,064. The minister indicated that the number of inpatients is 1,247, of which 374 are in intensive care units. The doctors in the Sultanate have detected a potentially fatal fungal infection afflicting some coronavirus patients. It's the first such known cases on the Arabian Peninsula, as the Sultanate faces a surge in COVID-19 infections that have swarmed its hospitals. The health minister reported today that 3 COVID-19 patients had become infected with mucormycosis, a life-threatening condition commonly known as black fungus. The fungal infection has spread quickly among virus patients in hard-hit India. Although the disease remains relatively rare, a sudden increase has stirred fears among doctors and health officials struggling to combat COVID-19 surges around the world. Omani doctors warned earlier this week that the Sultanate faces an acute shortage of beds amid the proliferation of highly transmissible coronavirus variants, as sputtering vaccine rollout and relaxed movement restrictions. Black fungus existed in India before the virus wave, but the condition stoked fears as it took hold in thousands of people either infected with COVID-19 or recently recovered. To shed light on this subject, we have live with us on the phone Dr. Amal bin Saif Al-Ma'ni, Senior Consultant Infectious Disease and Infection Control at the Ministry of Health. Dr. Amal, thank you for joining our bulletin.
Thank you. Thank you for interviewing me, and good evening for all the people who are following us.
Our pleasure. Can you please elaborate to us what is the mucormycosis? What are the symptoms and how people get infected with this?
Yeah, just to ease things on the people and not to freak them out, I don't think this is something that is really new or extraordinary. We have been seeing mucormycosis during our practice in the medical field in patients who their immune system is deficient. Whether this deficiency in the immune system has been inherited as congenital deficiency, or it has been acquired in population like the post-transplant patients or who are in immunosuppressive drugs, or the diabetic patients where the diabetes can affect their immune system. We have been always diagnosing those cases at different rates, depend on the seasonality and also the population of patients that we are dealing with. The new thing that really attracted people to this fungus as an opportunistic organism is that it has been reported in increasing number in India and linked to COVID. And the question was why we are seeing it more with COVID patients, and it's coming with COVID cases. Otherwise, the fungus is not a new medical diagnosis, and it has a treatment, and we can manage it if it has been diagnosed early. And this is what is usually we advise: early detection of the signs of the infection and early institution of the appropriate treatment.
Okay, so the relationship with mucormycosis and COVID-19.
So the relationship, and this, everybody is asking this question, it could be one of three. COVID patients who are immunosuppressed somehow are the sick patients. And this pathogen is living in our environment, and it's opportunistic. The moment it sees that our body defense system is coming down, it would take that opportunity to cause severe disease. So we know the severe disease in COVID is more that is gone to patients who are having chronic diseases and immunosuppression. So this is one relation. The other thing, and this is what have been observed not here in India, that it's probably linked to treatment related to COVID, like the steroids. The third one is that, it's there. And because most of the patients we are seeing now in hospitals is COVID, we are seeing it in relation to COVID. So that's the three things. Do we think it's increasing? It's very hard to answer that question. Because to say that you have a surge of cases this year, you have to go to your registry in the last years and compare what you are registering this year with the previous years to see whether there is a surge, and then investigate whether COVID is related to that surge. And then see the pathogenesis, why COVID would cause that surge if it's not in a host that is usually expected to have it, like diabetes or immunosuppressed patients.
Are the patients registered in Sultanate local or came from overseas?
No. They are local patients. They are Omanis, and they have been at home. They were not in hospital. They were diagnosed with COVID, spending their home isolation, and then they came to the emergency departments. And I'm very proud with the teams there who have detected the early signs of the disease and instituted the right therapy. Because of that, the patients are improving and they are on the right treatment.
And what are the prevention measures of this disease?
So being everywhere in the environment makes the prevention really very challenging because you don't see it. It's very minute, it's microscopic organisms, and it's there around you in the environment, in the dust, in the leaves, in the plants. Usually when we know that the patient is immunosuppressed, we try to advise them to avoid activities outdoor that involve dealing with decayed plants or soil, to avoid the exposure, and to wear masks when they are doing such activities, and long clothes. That has been said. We didn't observe that this might really prevent it. So the best advice at this time to give to people that if you see any early signs that there is a development in your state, in your condition as a COVID patient, go and report yourself to the nearest emergency department.
Okay, thank you very much for your time, Dr. Amal.
Thank you, pleasure, thank you.
That was Dr. Amal bin Saif Al-Mani, Senior Consultant, Infectious Disease and Infections Control at the Ministry of Health. Mass vaccination drive gets a good response as those under target groups flock at the designated centers across the governorates in the Sultanate. This reflects the social awareness of immunization against the disease. The Ministry of Health continued the immunization campaign for those deserve the second dose with the vaccines against coronavirus and first dose to the employees of state administrative apparatus. Still to come in News Bulletin. In order to limit the spread of wildfires, Southern California fire agencies are getting 2 large helicopters. Welcome back to the news from the Sultanate of Oman Television. The National Leadership Development Program, ITIMAD, started the implementation of introductory sessions for the group learning projects. It aims to empower the Omani management in the private sector, and we have a report on that.
In cooperation with the CAT of Oman, the National Leadership Program for Middle and Senior Management, ITIMAD, began orientation sessions for the second group of the first batch of participants in preparation for the start of their training. The program has been designed by international and local centers and institutes specialized in enhancing management skills and training potential Omani leaders in the private sector.
The target group for our program is 10,000 Omanis. We started last year with the first 250 graduates from the program, and we are starting this week for the other 250. So today we have the orientation sessions for the action projects, where we are trying to encourage the participant to choose challenges that they face facing the private sector, and towards the end of the program to propose the possible solution for such challenges. The other dimension which makes this program different than others is we do a follow-up process after they graduate. So we don't leave them after the program, we just follow up in the private sector. Where are they, what are they doing, and we get feedback from the stakeholders, especially that they were nominated from the company. What is the impact of the training in their actual practical practices?
I'timad program involves a combination of practical online classrooms, e-learning, coaching sessions, and action learning projects to be conducted in the target sectors and companies to which the participants belong.
The best factor I think about this program is actually mixing and mingling with other managers across the organization. First of all, it will give you an opportunity to get you to know the other organizations, and maybe it will also lead us to transfer this knowledge to our colleagues that are actually maybe a fresh graduates or maybe that are into the program to lead into this organization. I think one of the best tools here is meeting other colleagues from other organizations, and it's just like cross connection of interviews.
It is worth mentioning that around 250 participants from various private sector companies have been qualified within the first group. They went through a focused program on upgrading leadership skills led by international experts. I'timad program will empower the participants to take their place as future leaders in their organizations. صالح بخلفان الرحبي, Sultanate of Oman Television, Muscat.
Teams of vaccination centers are committed to carry out the vaccination process with the same courage and commitment that they've shown throughout this pandemic time. More details in the following report.
Nurses and their healthcare worker colleagues are committed to carrying out the vaccination process with the same courage and commitment that they have shown throughout the entire pandemic. Thousands of anti-COVID vaccines doses have been injected into people's arms across the Sultanate.
As we know, coronavirus cases are increasing every day, so take precautionary measures, and if you targeted for the vaccine, you should take it. I have already taken mine, and I feel comfortable.
As everybody knows that all these corona cases are increased. Intensive care units are full, everybody is sick, so please you have to take care. If you are worried to take vaccine, please don't worry, because I had mine, and don't listen to the rumors.
At this one of the main vaccination center in the governorate of Muscat, more than 2,000 people a day receive their vaccines, thanks to the dedicated work by the team of healthcare workers. As it can be seen here, this team, under the supervision of Dr. Fatima Al-Hinai, is gathered here at this time of a day after vaccination drive to review the work conducted and getting ready for tomorrow's walk.
The vaccination center at the Boucher Stadium, under the supervision of Dr. Fatima Al-Hinai, we are working as a team which is very cooperative and able to cover a huge number of public, thanks to the excellent cooperation.
Since joining the team here, I have seen great work, and higher number of people have and continue to receive their vaccine. Vaccine is safe and effective. If you are one of the target group, please come and take your vaccine to stay safe and healthy.
With the increasing numbers of COVID cases, don't live in a fear. Don't hesitate to get vaccinated. Get vaccinated and be safe. At the same time, keep following the preventive measures.
So far, up to last Saturday, 435,090 people across the Sultanate have received the jab that gives them protection from the coronavirus. Abdullah bin Ahmed Al-Rubai, Sultanate of Oman Television, Muscat.
The National Business Center, affiliated to the Public Establishment for Industrial Estates, Madayan, organized a discussion session with incubated small and medium-sized enterprises. The session aimed to review challenges faced by these enterprises within the current conditions at the local and foreign level. The session also reviewed best means and solutions that contributed in overcoming these challenges and supply entrepreneurs with modern mechanisms for marketing and promotion for products and services they provided. Preparations were being made in Geneva today ahead of a meeting between the leaders of the United States and Russia. Extra security was deployed around the summit venue, Villa Lagrange, as well as the two hotels where U.S. President Joe Biden and his Russian counterpart Vladimir Putin will be staying ahead of the talks tomorrow. It's a face-to-face encounter with the White House. Hopes will help bring some predictability to a fraught relationship that's only worsened in the first month of the Democratic administration. The Kremlin say the presidents will discuss the current state and prospect of Russian-U.S. relations, strategic stability issues, and the acute problems on the international agenda, including interaction of dealing with the coronavirus pandemic and settlement of regional conflicts. Southern California fire agencies are getting two large-scale helicopters that can each carry up to 11,300 liters of water or retardant to try to limit the spread of wildfires as hot, dry weather is setting in. Fire agencies Los Angeles, Orange, and Ventura counties, which are home to the combined 14 million people, said they're entering a partnership starting today that will help deploy critical air resources quickly to wildfires, including the two large-scale Boeing Chinook heli-tankers known as CH-47s. However, the tankers were pressed into service yesterday to handle a fire in Ventura County. Firefighters were making good progress on stopping the blaze from spreading, and no buildings had burned. The CH-47s will be able to drop fire retardant throughout the night, something they haven't done before, and that could significantly help the firefighters limit the spread of these blazes. This is the Sultan of Oman television. Before tonight's bulletin, here are the main points once again. His Majesty Sultan Haitham bin Tariq presides over the meeting of the Council of Ministers and directs to accelerate procedures for analyzing the needs to apply the technology and vocational learning. His Majesty clarifies that the coming phase needs coordination of all efforts by the state institutions to provide services, overcome obstacles, and hails the efforts exerted to deal with the COVID-19 pandemic. And His Majesty stresses on the continuation of economic cooperation with Gulf Cooperation Council countries and the Sultan's firm stance towards achieving peace and stability for all. And with that, we come to the end of the news bulletin from all of us here in the newsroom and the studios at Oman News Center. Good night and stay safe.